Why does dental health matter in the Army? What's going on, guys? Back at it again. Hit the subscribe button, like, comment, and share, and all that good stuff. We're going to be diving into dental care and why it's important for the soldiers, how it affects the readiness, and also what might get you, I said, disqualified at MEPS based on Army regulation. So let's get to it. Dental health may seem like a small thing compared to all of the physical and mental demands a soldier may face, but it plays a huge role in the overall combat readiness. If a soldier's dental health isn't up to par, it can lead to infections, pain, or even worse, taking them off the mission and making them non-deployable. And when you're under a tight schedule, every soldier counts. So at MEPS, where you go to for recruits trying to make sure that they're physically fit to make sure they can go into service in the Army, they'll check for your teeth just as thoroughly as everything else. So there are certain dental conditions that can disqualify you based on Army regulation, which I'm about to list in a few seconds. So this is in accordance to AR 40-501, the top 5 dental disqualifications you need to know if you're about to head to MEPS. So the first disqualifier is called a dental class 3 condition. So this means that you have any type of dental condition that can cause any type of emergency within the next 12 months. I don't know how you flip it, within a year. So this is important because the biggest thing that you have coming up where you're going to be gone for a substantial amount of time is basic training in AIT, and if you're an officer as an 09 Sierra, you're going to be going to OCS half a year that you're going to be in training, and that's not included if you get recycled or if you have a ship date that's extended. So they want to make sure that anything such as a severe cavity, untreated gum disease, or any type of tooth abscesses fall into this category. So they want to make sure that you're good within that year time frame, at least minimum. The number 2 disqualifier is missing teeth without proper replacement. So if you're missing multiple teeth and don't have a bridge, dentures, or implants, you can be disqualified. The number for missing teeth could be like 2 to 3. I don't want to put a fact on that, not too sure. But I know if you're missing like your whole bottom row or your whole top row, come on now, let's make it make sense. You got no dentures or nothing, you already know you're going to get disqualified. 2 or 3 teeth, I don't know, they might be able to work with you. I don't know, that's probably subjective to the doctor, whoever evaluates you. But make sure you have some type of proper replacement for those just in case to avoid any type of issues. Because the Army needs soldiers who can eat and function properly in the field, especially in the field. So that would be a big issue for you guys if you have missing teeth without any replacement. The number 3 disqualifier is a severe improper bite. So that means any overbite, underbite, or any serious misalignment that can get you disqualified if it interferes with your chewing or your speech. Now, if you have a small overbite or underbite like me, I have an overbite a little bit. It ain't gonna be too big of a deal, but everything's gonna be subjective to what's severe and what's not severe. So if you think it's something that may be an issue, I don't know how you fix it. I don't know how you fix overbites, like braces or whatever, or jaw surgery. I have no idea personally how to fix an overbite, but that'll probably be subjective to whoever the doctor looks at. But if it looks crazy, like maybe you can Google what a severe overbite looks like, and if your overbite or underbite looks similar to that, then you're probably gonna fall in that category. But I'll say at least show up to the doctor and let them say that for themselves, you know. The number 4 disqualifier is an active infection. So this is pretty obvious. So this is indefinite no-go for sure. All the other ones could be subjected to who looks at it, but an active infection is definitely a no-go. Doesn't mean you're gonna be permanently banned from going into the Army. It's gonna be a situation where if you have a dental abscess or any type of advanced gum disease, you'll need to get that treated before you can pass the MEPS screening, because that violates that class 3 condition, which you make sure you can have any infection within that 12-month period. So take care of that first before going in, and also make sure you get your teeth checked to see if you do have any active infections in your mouth before you actually get evaluated, to save you the time of showing up to MEPS and then they see you have a major gum disease and they're gonna tell you to get it fixed anyway. So take care of that first before you show up. This is my opinion. That's immediate no-go for sure. The 5th disqualifier is jaw and facial deformity. So if you have any type of severe jaw issues that can affect your way you chew, how you breathe, that's another red flag. So you'll need to get surgery or some type of treatment to correct it before you can enlist. And again, this is something that is very subjective, but if you Google what a facial deformity or jaw deformity looks like, disqualifier on Google, and your jaw looks something similar, probably might want to get that fixed beforehand, because severe can be relative to the doctor looking at how the doctor looks at it. So I will still show up to that one. But if it looks obviously severe, not obvious like, oh, it's because my jaw look a little bit misaligned or whatever, but if it looks obviously like you looking like your jaw over here and your mouth over here, like obviously you gonna have to get that taken care of. But everything else I will go in there and see before I like kind of say, nah, I don't want to do it. Just check it out. Just go to the doctor and see what's up. So if you're thinking about enlisting or commissioning, make sure your dental health is in check. So you don't want to be sidelined for something that's preventable, like a cavity or a missing tooth. Something petty. You don't want to be one of those, man, they disqualified me for 6 months because I had one missing tooth. What happened? Try to take care of that beforehand if you can. But like I said, this could be subject to the person, but don't get mad at me. You know that's a disqualifier. So just be wary on what I say, but those are definite. So if you think it's bad, just go take care of it beforehand so you can minimize any type of potential waivers that you need to sign or any delays into your process of joining the Army. So if you know anybody that had jacked up teeth, if you know people that got some crazy teeth that want to join the Army, send this to them. If you found this video helpful, hit the subscribe button, like, comment, and share, and also share your experience about MEPS. And if you got denied or if you had issues with the teeth or any other type of medical issues, plus I'll make more videos like this as well too. So if you have any other conditions that you are interested in me talking about, put it down in the comments below. Hit the subscribe button and I'm out. Gone.